Yeah, when we set up our brain bank, I think, I think like many of us, being told that you have a terminal condition was just awful.
Hmm.
It's one thing to be told you've got a really difficult disease, but one that's considered terminal just sounded awful. So we thought, okay, let's confront this. We want to move this disease so that it's not considered terminal, but it's considered treatable. And how do we do that? Let's let's say, okay, this is a treatable disease. That's what we want to get to. That's our aspiration. So we wanted to confront that straight on in the tagline so that people could see we're not just about making things a bit better. There are many groups in glioblastoma, many groups, many people working incredibly hard. We aspire to turn this disease around, not just for me, not just for you, but for everybody. We want to rid the world of glioblastoma. So we've got a high ambition. And our sense was that if we don't have that high ambition, we're going to inevitably fall short. Now, so far, we're pretty chuffed with what we've done. We went live with the app 2 years ago, and we now have more than 400 people in the United States using the app. And that's one way of demonstrating that people want this, because they're believing in that, what we're doing that could actually help. We've also been able to say that we've got all these people involved. We've also got things like, as a result of building this community and with the app, we've now researched and consulted with hundreds of people with glioblastoma, and we will be launching a Bill of Rights. Because at the moment, because we're people-centered, that when you get glioblastoma, you're just told you can have chemotherapy, the standard of care. But us as patients have much more, I think, to offer than that. And we can help the doctors with that. So we know that if everybody, for example, when they're diagnosed with glioblastoma, if we could encourage the medical profession to say, we don't have the answers, but everybody is entitled to a second opinion upon diagnosis. If we just made that one change alone, we would be able to encourage competition from medical researchers so that people would get a choice and therefore would get better outcomes. That's one example that we're working on in our Bill of Rights, which we'll be launching in the summer. And what it will mean is that instead of having glioblastoma seen as something that's just a medical condition, it's a human condition. We work with the scientists, and we work with the patients and the people caring for us. We think it's a much better approach to do that, because then we'll be in hand in glove.